Good morning, everyone. Welcome to the Professional Development Training hosted by Vermont State University Multilingual Student Services. I am Mary Dean, the Associate Director of Vermont State University Multilingual Student Services. And in today's sessions, we welcome Dr. Mendoza Fierro to conduct a webinar titled Building Confidence in Healthcare Communication, a culturally responsive and interactive approach for multilingual nursing students. This session is available for students from 9:30 to 11 a.m. and then we will have a second session for faculty members working with multilingual nursing students and allied health sciences at 12 today. So this session is available to students and it focuses on clinical communication strategy, medical vocabulary development, participation and confidence in building their interact through interactive and gamified practices. It will speak directly to several important challenges that affect student success and retention in nursing and allied health sciences, including medical terminology, time pressure in standardized exam, and first language and processing information through a language not their first language. If you know any multilingual student in your classes, please share this information and encourage them to reach out to the Multilingual Student Services Office whenever they need help. Before we start the session, please let me have a chance to tell you a short bio of our trainer. It is my honor to host Dr. Laura Mendoza. She is the Assistant Professor of Instruction and the Director of Undergraduate Studies at University of Texas at El Paso, where her teaching and research focus on inclusive bilingual pedagogies, translanguaging, gamification, and equitable support for emergent bilinguals. She also specialized in language for specific purposes, including medical Spanish, Spanish for nursing and pharmacy, Spanish for occupational therapy, and has prior teaching experience in medical Spanish at Paul L. Foster School of Medicine. Her background makes her especially well positioned to support both multilingual students and faculty who teach them. So it's my honor to pass the floors, and the floor is yours, Dr. Mendoza. Thank you so much for your presentation today.
Thank you so much for the introduction, Dr. Dean. Do you think I can share my screen?
Yes, so please hold on a little bit with me. So I think you can share your screen now.
Okay, perfect. Thank you. Well, welcome everyone. Again, thank you, Dr. Dean, for that very gracious introduction. My name is Dr. Laura Mendoza. And today we're going to be paying very close attention to something that's critical for your success, not only in your nursing program, but just in general while taking exams, and most importantly, in the real clinical settings. Something that we're going to be dealing very confidently with today, it's going to be communication under pressure. So that's going to be one of the most important things that we need to talk about today. So this workshop is titled Building Confidence in Healthcare Communication, a culturally responsive and interactive approach for multilingual nursing students. We're going to work on four different areas today. So, first of all, how to communicate more clearly in clinical settings. Second, how to use medical vocabulary but in a more efficient way. Third, how to respond faster under pressure. And last but not least, how to improve performance in all your different exams. So, I would like to pause just for a second and reflect on your own experience. So, let's think about this for a moment. When do you feel most confident communicating in English in healthcare settings? And also, I want you to take a second and think, when do you feel the least confident in English in healthcare settings? If at this moment you're watching the video, I would like you to pause it for a second and actually write down your comments to these. So just take a moment to realize, when are you struggling the most? But also, when do you feel very successful when you're using your clinical vocabulary? Something that I've noticed through the years is that usually most students feel confident in slower situations, but they tend to feel less confident when they are under pressure. And that's completely normal. That's something that we're going to be revisiting several times during today's session, because that's something that happens not only to multilingual students. Actually, that's something that happens to all students. Something that we need to start thinking at this very moment is that the type of vocabulary that we use in our daily lives, it's a type of vocabulary that it's not innate. It's something very specific. It's a vocabulary that we use in clinical settings. So even native speakers need to learn this type of vocabulary. So this is something that we need to remind ourselves all the time. So now consider this. Under pressure, what feels hardest? Understanding, vocabulary, is it the speed, or is it the speaking? Just pick one mentally, and this is going to help you to identify your main challenge. If you selected understanding the question, then we need to work a little bit more in your comprehension. Were you reading the question? Were you listening to the question? So, what are the types of skills that we need to polish right here, that we need to work with? If you selected finding the right words, maybe you are actually understanding everything that's happening around your world, that particular clinical setting. The problem right here is that you are overthinking for a very specific type of word. Remember, you can always describe the idea, you can point to an item. If it's speaking fast to know, think for a second. Do you actually need to speak very fast? If you're speaking super fast, maybe your patient, it's not going to understand what you need. Maybe your supervisor, it's not going to understand what you need. So, do you really need to speak fast? And if you selected, again, remembering medical vocabulary, Maybe there's another way to say it. We're going to continue building on this in a second. If you feel slower, that does not mean you're less capable. It means your brain is your processing different languages, and that actually requires more cognitive effort. Always remember your multilingualism, it's not a weakness. In healthcare and in very different scenarios, actually, this is gonna be your major strength. So think about that. Right now, maybe you're feeling that you're struggling, but at a certain point, this is gonna be your superpower. Multilingualism at all different levels, it's gonna be always your superpower. So keep that in mind. But what happens under pressure? Under pressure, many students begin translating. They just start searching for words. And this leads to loss of times and confidence. If you are translating or trying to translate instead of actually paying attention to what others around you need, you're just wasting time. Pay attention first and then go ahead and start translating for you. It is important to remind yourself at all times that you cannot lose confidence. You need to pay attention to the task that you are completing at that particular time. But how are we going to solve this? Well, let's see. First of all, it's crucial for you to understand that the problem it's not your English. The challenge that you're facing is the processing speed. How quickly you can access what you already know. So think about this. You already have the knowledge. The problem that we need to face is how are we gonna be making all that information accessible because what you need is the output. So, even if you're facing a cognitive overload, you need to find a way to solve this issue. So, how are we going to be accessing that type of knowledge that you already possess? You need to practice and find the language patterns that are commonly used in your field. Again, the English is not the problem. Your English, it's not a problem. Okay? It's just how are we gonna be processing everything else? As we've been saying today, your multilingualism is your superpower. Don't forget about that part. Just a second ago, I was mentioning that you need to think in patterns. So, instead of trying to translate word by word, you need to find the common patterns that are used in your field. Why am I saying that you need to translate word by word? First of all, because not even in your native language, you would be able to know every single word that exists right there. It's impossible or almost impossible, right? So we don't need to do that. And then, second of all, actually, when we're translating, if we are doing a translation word by word, it's pretty likely that that translation it's not going to be accurate. We need to think in chunks. When we're translating phrases, we need to think about the whole context. That way, it's going to be meaningful, and most importantly, it's going to be culturally relevant, right? In other words, it's going to be making sense to the type of population that you are dealing with. So that's going to be very, very important for us to remember at all times. And that's why we need to pay close attention to the type of phrases that are used in your settings, but also in your region. Think in patterns. In other words, translation is a very slow process. But if we can learn the patterns, we're going to be able to communicate at a faster pace. Patterns are going to be the key. Patterns help you to respond faster because you understand better what's going on. We just need to fill in the blank. And also remember, structure reduces stress, but at the same time, it's going to be building your confidence. And we have been mentioning today that you cannot just lose your confidence, right? Just remember that you do have the knowledge. You just need to remember how to apply it appropriately. It's the output that we need to pay attention to. That's the reason why we need structure. How can we deal with that? A very easy example would be, for instance, using the SBIR framework. Okay, think about the situation. What exactly are we facing at this very moment? Think about the background. Do I have additional information that I can connect to this particular background? Think about the assessment. What's going to be happening with the information that I've already collected? And also think about the recommendation. What are the specific sentence patterns that I need to communicate a good recommendation in this particular case? Without structure, we're going to be facing something very similar to what we're seeing here in the screen. We're trying to remember word by word, but we're not actually paying attention to what was happening. So we're going to have, okay, the patient, but what about the patient? Not feeling good? No, no, no. Dizzy? No, no, what's happening? If we are having an encounter with a patient, we don't need to remember that particular part, right? That's pretty straightforward. So, what are the words that I need to pay attention to? What do I need to prioritize? So, again, if I don't have a structure, if I don't have a pattern in my mind, I cannot pay attention to what's going on. So, this is what I'm saying. Trying to remember, oh no, oh my God, too much information right now. But ta-dan, with structure, you're gonna be able to remember very well what was happening. The patient is experiencing dizziness and reports feeling unwell. This is going to be a sentence pattern that it's going to be very, very common in our field, right? The patient is experiencing. So if I have that sentence pattern, I don't need to worry about that part because I know we're going to be talking about the patient and I know that what follows it's going to be experiencing. So it's just the fill in the blank part that I need to pay attention to, right? Okay, so dizziness, feeling unwell, dizziness, feeling unwell, dizziness, feeling unwell. So that's shortening my cognitive overload, right? Very easy to access, but at the same time, very easy to remember because I already have my structure. So, a very important recommendation today, it's gonna be using high frequency sentence starters. In other words, those sentence starters that we use all the time, again, in our clinical settings. The patient is experiencing, the patient reports, the patient presents with, maybe the patient denies, because that also happens, right? So just careful with that one. But these sentence patterns are gonna be giving us the structure that we need in order to just focus on what's important, right? We don't need to think about the first part of the sentence, just the relevant words where we're gonna be prioritizing. So let's practice for a second. Let's try to rewrite this sentence. We have the patient not breathing well, tired. So just pause the video for a second and try using one of the sentence patterns we were reviewing and complete your sentence. This type of practice is going to be building your automatic responses. So, something that you could easily get just from paying attention to this unfinished sentences would be something similar to the patient reports not breathing well and denies feeling tired. Or something similar, right? So I'm just giving you a couple of sentence patterns that you can use. But as you are more involved in your clinics and your practices, you're going to be able to listen more carefully to other different examples that are very, very common in your fields. So pay attention to those. Just take notes about those and practice with them. What are other things? What are other symptoms, for instance, that I could replace? What are other words that I could use if I'm starting with this type of phrase? Remember, fluency comes from repetition and from patterns. So we don't have to memorize a bunch of things. Actually, in many different scenarios, memorizing things is not going to be as handy as you think. What you need is actually repetition. Practice with these four sentence starters, but just think about the many different fill in the blanks that you can have right there. The patient is experiences shortness of breath. The patient is experiencing anxiety. The patient is experiencing, and then you add something else. What are all the different possibilities that we can complete with that particular sentence pattern? Repetition is the key. Repetition is the key. And that's obviously why am I repeating a lot today, because that's what's going to be helping you with your fluency. Something that I haven't mentioned, but it's extremely important to do at this time is to stop for a bit and remind you that the type of English that you need to be fluent in is just clinical English, right? Because that's the type of setting that you're going to be dealing with on a daily basis. So, nursing type of English, in other words. So, you don't have to be extremely fluent socializing with friends. At some point, you'll be, because that's the way we learn languages. But at this point, the type of English that you need is exclusively clinical English. Again, a very common mistake that I've seen for many, many years now is The students just try to memorize everything at once. And that's why they're not able to remember a bunch of things because lists are just too long. They are not connected. So, in a way, they're not making sense in their heads. So, memorizing low vocabulary list is not effective, particularly if we're adding the under pressure stance. So it's important for us to understand and to remember what we just covered. What we actually need is patterns. We need patterns, and we need to repeat those patterns several times. Because based on those patterns, we're going to be able to contextualize our different scenarios. So, what are the things that I do on a daily basis? What are the phrases that I always need to remember? Something that I usually teach my students day one is how to introduce themselves in a clinical settings. Good morning. My name is Laura Mendoza. I'll be helping you today. Very easy phrase, but also very important, right? It's just introducing yourself, something very short, but it's a pattern and it's repeated because maybe you're gonna have different patients during the day. Maybe you're gonna be introducing yourself several times during the day. So that's just one short example. More effective strategy then would be to learn vocabulary in context instead of trying to memorize those very long lists of words. Again, you need to use patterns. You do not need to have isolated words. Do not do long list of vocabulary because especially if they're not related, you're going to have a hard time learning them. Something that I've seen a lot is that, for instance, if you're practicing directly or trying to memorize directly from a textbook, many of these words are going to be in alphabetical order. So we have a problem right there. Okay. So they're not necessarily connected, they're just listed in order. Okay. So for some of you, it can be kind of handy, but it's not certainly the best strategy. We need context because patterns are the key. Remember? So you need to pay attention on how vocabulary is used, but in real scenarios, in real life. So, for instance, we're not going to have the term and then the definition because that's going to be kind of tricky to access when we're looking for that type of knowledge in our mind. Instead, we need to see the whole picture. For example, the patient is experiencing shortness of breath. Oh, okay. Tienen problemas para respirar. Okay, yes, the patient is experiencing shortness of breath. Good. Okay, so I have the whole picture now. We need to prioritize higher frequency clinical language, right? We need to pay attention to that type of English. A second ago, I was explaining to you that the type of English that you need at this point is specifically clinical English, right? Those are the types of words that you actually need to find a pattern for. Those are the ones that you're going to be using the most. So those are the ones we need to practice. Okay, so what words are related to symptoms? Okay, but also what are the words or phrases that are commonly used if I'm completing the patient reports? Yes, perfect. What about the conditions? What are common conditions that I need to practice, perhaps for this particular part of the semester? Okay, okay. And very important, what are the actions, right? Actionable items that I need to pay attention to? What are the phrases that are commonly used that are related to actionable items? Okay, yes. So everything is learned as part of a group. All the symptoms together, everything that I need to complete a form, common conditions that at this stage, I deal with. Because again, we're doing clinical vocabulary, but we're not doing everything at this very moment, right? Everything is learned by stages. So just pay attention to those. If you need faster recall, you need to learn vocabulary in different chunks, right? So think about the examples that I have right here. I have shortness of breath, I have chest pain, loss of appetite, elevated heart rate, and think for a second. And here we're not rushing, so we have all the time, right? So think for a second. How are these things related? Can we connect them? Do we have a context? Think about a scenario where we can put everything together. Or if not everything, at least half of them. We need chunks. Just like we were seeing in the previous slide, we were putting together all the symptoms. We were putting together the specific vocabulary that I need to complete a form, to type a report. Okay? It is always the same pattern, pattern, pattern. There's always a pattern in language. Something that's going to be very important for you as you are improving your linguistic skills in English would be to practice. Complete your own sentences. If you have this sentence pattern, the patient is experiencing, what else can you add to this same sentence? Pause the video for a second and write down 3 complete examples. But listen, do not just fill in the blank. Do the whole sentence. The patient is experiencing 1. The patient is experiencing 2. The patient is experiencing number 3. Because part of the practice is internalizing the sentence pattern. Because remember, in real life, when we're trying to access that type of language, or when we're trying to evoke that type of language, that way we don't have to think. Because I know that what's coming is the patient is experiencing. But what are the different possibilities that we have? What are the different options that we have to complete this particular sentence? Take a second. So we've done, the patient is experiencing shortness of breath a lot today. So let's do something different. What about the patient is experiencing a burning sensation? Same pattern, right? Just different fill in the blank example. But the pattern was exactly the same. What are other examples that you have? Do you have any different ones? Were you using shortness of breath? That's completely fine. That's why we're practicing. We want to ample our sentence patterns. So what's the key strategy? The goal for us is to recognize, to understand, and to use language efficiently. Okay? We need to recognize, understand, and use language efficiently. You do not need to translate everything. Remember, perfect translations are not going to be word by word. So recognize the language that they're using. What's the sentence pattern? Do I know that sentence pattern? So from the ones that I have, pick, am I actually following? Do I fully understand? Okay, yes, yes. So go for it. Use it. Something that's also crucial for you to remember at all given times is that you need to use your first language strategically. For instance, I understand that the linguistic background for many of you is either Spanish or French. So then use cognates, okay? Because you're gonna be just connecting everything in an easier way. So cognates are going to be those words that they look very similar in two different languages, and the meaning it's going to be actually the same in both languages. So for instance, English and Spanish, right? So think about those words. In healthcare related settings, we have several cognates that are going to be helping you in that particular respect. Okay. So just use those and stick to them because it's going to be giving you another way to process your language, but also to produce language faster because you already know those words, or it's pretty likely that you know them. Avoid translating if you are under pressure. Remember, you have the knowledge. Just receive the information and think for a second. Just receive the information and pause. Make sure that you're using your first language to understand different concepts. Make sure that you're using your first language to make connections and make sure that you're using your native language to learn faster. I was giving you an example of how to use the cognates a second ago. Make sure that you're able to connect many of the things you're learning to your own community, to your own life, to your own very own language. Because that way it's going to be easier for you to internalize everything that you're learning and at some point do the output in English. Because you don't have to worry about understanding the material. So make connections with your native language at all times. On the other hand, use English to respond. You're going to be using English to communicate. You're going to be obviously using English to perform well in your exams. Okay, so the output it's going to be in English, but everything that you are digesting can be in any um, linguistic um, can be in any language that you prefer. If it's your native language, go for it. So, in short, the goal must be to understand in any language, right? All the different linguistic resources that you have at hand, use them, but try to respond in clinical English. Remember, today we've been distinguishing between different type of Englishes if you want. So the one that you need to successfully perform in your field is clinical English. And that's the one you need to find patterns for. That's the one you need to practice the most. And that's the one you're going to be using the most because that's your area of expertise, right? So you need to build on that type of vocabulary. You don't need to know every single word again to socialize with a stranger on a bus. You don't have to yet, okay? You can start little by little, and that little by little, it's gonna be by using the sentence patterns that we commonly use in clinical settings. Remember, usually the real challenge, it's not the knowledge, but the speed. Okay? You do have the knowledge. Don't forget that. But the speed in which we're accessing all the information can be a challenge. Also, for many students, a challenge can be the speed, but in terms of producing something, right? Just repeating information for a supervisor or for a patient, rephrasing. And many multilingual students have the idea that they need to speak very fast in order to produce a good type of language. But that's not necessarily the case. We've been discussing sometimes even in our native language, if we're speaking too fast, people get lost. So we don't have to speak very, very fast. Very important to remember that you don't need perfect English. You just need clear, functional, and very, very important for our fields, safe English. Because we're going to be communicating with our patients several times during the day. So the communication that we're producing must be safe, right? The short phrases, the sentence patterns that we're using must be functional but safe. And something that I want to highlight in this particular slide is that we make mistakes in our native language every day. We don't even notice. We don't even pay attention to. We make fun of us if we do it. Look what I say. It's completely fine. We're able to live with that completely fine. And we need to think in that same way when we are experiencing other linguistic variations. When we're using all our own linguistic repertoire, when we're using all the words that we have, we need to think in the same way. If I make a mistake, it's fine. I just move on. Okay. If it's something in our particular field that it's unsafe for the patient, I rephrase immediately. I'm sorry. What I needed to say was damn, 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 right? But we don't need perfect English. We do not need perfect English, just functional, safe English. Use ready-made clinical language. Again, these are the sentence patterns that we've been practicing with today. The patient is experiencing, the patient reports, vital signs indicate. So that's a new one, right? But also very, very common in our field. So, how can we finish this sentence? Again, if we practice several times with this ready-made clinical language, we're going to be able to access it and to produce it in a very natural way because that's part of us now. If I know that I always need to start the sentence with the patient reports, this is what the person is saying. I just need to complete my sentence. I just need to worry about the second part of it because I've internalized the first one. I'm always starting with the patient reports, and that's it. No more information because I don't need extra, right? In real clinical scenarios, we need to be very clear. So, not very worthy because it's going to be very confusing, right? So, we need very specific words, clear. So, let's practice. Let's try to respond to this scenario. The patient feels dizzy and weak. The patient feels dizzy and weak. What are the sentence patterns that we can add to these sentence that we have right here? Is there anything that we could change? Is there anything that we could say using different type of words? Would it be easier for me to say the patient reports dizziness instead of feels dizzy? Or is it the other way around? What's more practical for me? What's clearer? What's going to be safer? Can I think of other examples? Can I contextualize this? Think about the big picture. What's the scenario? Do I have more background information? How am I going to be assessing this? Do I need to make any recommendation at this point? Remember, fluency developed through repetition and patterns. So we've seen this diagram before, right? I had it in the past. I'm just adding one little thing. Can you see which one is new? Yes, practice under pressure. Practice under pressure. It's the new item, right? So it's very important to practice. Yes. But what's actually important for our type of field and to be successful, for instance, when taking tests, it's going to be practicing under pressure. Time yourself. Time yourself. Get a timer. Revisit this video. Each time you're pausing to complete a sentence, give yourself less time and less time. Continue practicing. Notice that exam success requires strategy, not just content knowledge. And this is something that every student needs to remember. So this is not specific of multilingual students. You need to know how to take a test in order to be successful when taking a test. If you want an A, you need to know how to take a test. It's about strategy. So, common challenges for multilingual students, they try to understand every word. Don't do that. Do not try to understand every single word. You need to pay attention to what's relevant, not every single word. So we've mentioned this before today. In your native language, you don't know every possible word, right? But you're able to manage yourself pretty well. Okay. So think about what you need to pay attention to. Okay. If you start translating word by word, you're gonna be running out of time. So avoid translating word by word. Just look at it, relevant words, content. Okay, I do understand the content. I have the knowledge. Okay, so this is the answer. Perfect. Pay attention to the meaning. Do not try to understand every single word. And you're going to have instances where you're going to be able to understand every word, and that's perfectly fine, but you don't have to. It's just about the content. It is just about the meaning. And how are we going to be doing that? We need to learn to identify the keywords. Okay. So you need patient conditions for sure. You need to pay attention to the symptoms. Look for priority words. This is going to be very handy when in clinical settings, but also taking exams. Common keywords that we need to pay attention to: first, priority, best, immediate. If we have something like this, you have the keyword right there. You have the important information right there. This is what you need to do. Okay? These words are yelling to you, read me, because this is the important part. When you're paying attention, when you're listening to something, we also use disconnectors all the time to emphasize information. So pay attention to those words, right? That's the first trick. Another step, just go by elimination. Eliminate the wrong answers. Okay? Choose the best available answer, not a perfect one. So the first thing that you need to do is to get rid of the ones that are obviously incorrect. So if you have four answers, two are pretty much wrong. Just get rid of them. That way you just need to pay attention to the two that you have left. Okay? And out of these two, which one is the best? Which one is the safest option, right? Which one makes sense? So you always need to eliminate the incorrect option first, right? Remove clearly incorrect answers. Just compare what you have left and pick the safest. What's the safest in a clinical setting? Number three, which is what we've been covering during all this workshop, right? Avoid full translation. What's our goal? We need to read, we need to understand, and then we need to decide. We're not translating every single word because maybe we're not going to be able to connect everything. We need to just read, understand, and decide. So pick an answer. Pick an answer. What's the meaning, right? Pay attention to the meaning and then just go for it. So let's apply the strategies we were covering and identify the priority. So it says, a patient reports chest pain and shortness of breath. Right here, what's the priority action? So we can give them food, we can assess vital signs, we can let the patient rest, We can document later. Think for a second. That is correct. We need to assess the vital signs. Remember, as we've been revisiting several times during today's workshop, you do not need perfect English. You need an English that it's gonna be helping you to safely communicate in a very particular clinical setting. Success depends on reasoning, not perfect English, okay? So think about all the strategies we have been practicing with today and select the one that best works for you. And maybe it's more than one. Maybe you can use all the different strategies and that's perfect. But maybe you're gonna be tied to just one at the beginning. And that's also perfectly fine, okay? Keywords, for instance, that's the easiest one to start with, right? Because those words are just yelling at you, I'm important, I'm important. Pay attention to me. Just life, time pressure is part of exams, okay? Time pressure is real, but you must learn to respond efficiently. And again, you need to learn to manage your time, even in the event of taking an exam in your native language. So you just must make decision very quickly, okay? So think about the meaning, focus on the meaning, and decide. Focus on the meaning and decide. Again, time yourself. Time yourself. It's going to be very important for you to start timing yourself early on during the semester. That way you feel comfortable with that. Avoid losing time by overthinking or translating word by word. If you see a question and can answer immediately, just trust yourself and keep the answer. Um, Something that I see a lot is that um, students start doubting themselves when they're taking a test and they just start changing their answers. So they see a question and they answer immediately. And then they go back and they were like, no, 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 this is not, no, maybe they're asking something else. At the end, they change the answer and the second one they pick was incorrect. So the original answer was the one that was correct. And I see that technically every week. So just trust yourself. Um, Again, time pressure is real, so think fast. Okay? Perfect, but just do it fast. And continue timing yourself. You need to feel very familiar with timing yourself and being time because that's going to be part of your career. Everything is happening very fast. So what's a strategy? Just move forward, okay? If unsure, just choose one and just move on. Okay? Just make the best decision. Do not stay stuck. Okay? Just move forward. I think it's just one. Okay. Because otherwise, you're going to be wasting time. If you're able to then go back and revisit, but your first instinct should be just to complete everything and keep moving forward. Another thing that I see a lot with multilingual students, with all students actually, but especially with multilingual students, is that they reread excessively. It's okay to reread because maybe we just need to We just need to do it right once. That's fine. But just trust your first understanding. If you keep rereading and rereading and rereading, you're gonna get confused. So just trust your understanding, okay? Because otherwise, it's very likely that you're gonna be ending up like the example that I was sharing with you a second ago. You're rereading and rereading and rereading. You change the answer, but the original answer was the one that was correct. So just trust yourself. I've been revisiting a lot how important it is for us to time ourselves. Speed improves with practice, but also with familiarity. Okay, so practice, 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 practice. Think what are the phrases or the sentence patterns that are commonly used? Usually, if something sounds just weird, sound unnatural, it's very likely to be incorrect. So practice with time questions. This is the key. Practice with pattern recognition, which is something that we've been doing today in a very intentional way. And after this workshop, you should be doing it that as well. Pay attention, but very intentionally to the ways in which the conversations are starting in your clinical settings. And practice decision making, which gotta happen very fast, okay? But particularly in order to be successful while taking tests, you need to practice time questions. Recognize patterns instead of translating, okay? Speed comes from familiarity. We've been mentioning this a lot. So let's apply everything that we have been working with today. This is like our final practice. So you're going to read the scenario and you're going to be identifying the key information. It says the patient reports dizziness, fatigue, and shortness of breath. The patient reports dizziness, fatigue, and shortness of breath. Again, think about all the strategies we've been using because we're going to need it. Gonna need that information in a second. Do you have the info? Okay, so let's move. I want you to write one complete clinical sentence using a sentence starter or one of the sentence patterns that we were using to provide the information that was shared with you in the previous slide. Do you remember what was the information? So think, how do we usually provide this type of information? How do we usually say it? What's a natural way to say it? Task number 2, decide the priority action. In real life, what do you need to do? Think like a nurse. What do you actually need to do? What's your priority? Is it feeding them? Explaining to them how to take their meds? What was the priority at that very moment? Remember, we need to decide fast, 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 and faster. Answer quickly. Do not translate everything. We need to use patterns. We need to use sentence patterns. If the patient was experiencing, then we need, So what happened? How did you manage that scenario? Did you use a sentence pattern? Hopefully you did, because we've been practicing a lot with that today. Did you avoid translating everything? And maybe that's something that's coming natural to you at this point. Just let's revisit. How can we work with that strategy? Because we've been given other type of strategies that are going to be more handy in our situations. Were you paying attention to the key information? What were the words that were yelling at us? Ah, I'm important. So our first takeaway of the day, structure. Structure builds confidence. Our takeaway number two, fluency comes from patterns, not from memorizing isolated words. And this is actually very important to remember because again, as we have been discussing today, many students are under the impression, and this is not specifically of multilingual students, students in general. They have this idea that they need to memorize very, very, very long list of words in order to be successful in their clinical settings. And that's not necessarily the case. They do need to practice with a lot of vocabulary because we just need to relearn a different type of English, right? This is something that's very specific. As I mentioned at the beginning, this is not an innate. For many of us, this is not something that's coming natural to us. Maybe in our communities, this is not the type of language that is used. Maybe in our homes, this is not the type of language that is used. And that's perfectly fine. We just need to learn it. But by memorizing very long list of words, we're not going to be able to do it. We need to put them together in groups, right? We were mentioning, for instance, today, we can practice with specific type of symptoms, right? Maybe specific type of diseases, just group them together. If we are contextualizing, if we are providing a bigger picture, then we're going to be able to learn those words because that's what we need. We need to understand the context. We do not need to memorize. The only part where we're technically memorizing is as we're practicing very, very often the sentence patterns. Just because we want to just make sure that that comes naturally, right? The first part of the sentence. Takeaway number three. Do not translate everything. We need to focus on meaning, but also on the action, right? Not word by word. Not word by word. Just try to understand. And number four, which is the most important of all. Remember at all given times that you do not need perfect English. You need clear, functional, and safe communication in English. Okay? It's perfectly fine if you're not able to remember a word. You can always describe the idea. It is perfectly fine if you do not know a word, Again, you can always describe the idea. Earlier today, I've mentioned you can always just point to an item, right? This is what I was referring to. This is what I'm trying to show you. Use your body language. That's something that I hadn't mentioned, but also very important, right? And that's actually very natural when we're speaking. And it's also very important for our patients because sometimes, first of all, they might not be feeling well, or so it's hard for them to fully pay attention to if you are giving them those extra hands. If you're using your body language, that's gonna help them also to better understand what you're trying to communicate. Um, Takeaway number 5. Use your multilingualism as a strength. Always remember that that's going to be your superpower, right? You're able to do a lot of things in two different languages, and that's just fantastic. So you need to be very proud of yourself. Remember, what you're doing right now is a step further. So this is something that all students will have to learn. This is clinical English. So just be very proud of yourself and everything that you're accomplishing until this point. So just the final message for all of you, you can do it, okay? What you're developing right now is clinical English, but you're gonna be ready. And very important for today's session, you are becoming a healthcare professional. Some additional study strategies that are very, very helpful nowadays are related to how can we gamify our learning? How can we make sure that as we're playing, we're also practicing, right? We can, for instance, use Quizlets for spaced repetition. And today I've been mentioning a lot. Do not memorize long list of words. And technically, like, one of the things that Quizlet is recognized for, it's because it gives you flashcards so that way you can memorize vocabulary, right? You can play with that vocabulary. So one thing about these flashcards is that you can decide the way you're gonna be practicing with and the way that you're gonna be dividing the information. So you can create Quizlets where you do have the word with a translation, if that's sufficient for you. You can also have flashcards where you have the word with a definition, perhaps the word and a picture. That way you're just able to very fast provide an answer. I think that's one of the best strategies usually. That's why I recommend to my students just having the word with a picture. That way they see the picture and they can just name it, right? But again, group them, put them in such an order that you're able to connect the information. If you're using Quizlet, you can definitely time yourself because you have different different games. Let's say it that way instead of Quizlet, where you can definitely play Zolo and you can set a timer for many of them. It's not just based on the flashcards, but it can generate quizzes for you. It can generate things that are timed for you, but like game-based practices. So, and there's a free version for sure. So you can just directly connect it to your Gmail account, for example. Also nowadays, we can use artificial intelligence to practice. Just feed GPT or any other tool, just feed the information for you and listen, or let AI help you to practice saying it. Can the bot recognize your voice? Can the bot understand what you're saying? Or just ask GPT to give you questions similar to the type of questions you're gonna be using for your exams, right? Again, time yourself. And talking about timing yourself, you can definitely use Kahoot, which is very good with a timer and having like panic sounds for you just to move fast enough, right? And you can decide how much time do you need per question. Maybe you need just 20 seconds, which is the standard for these type of questions. Maybe you need a minute to actually think about it. And you can play with the timing as you are progressing, as you are practicing more and more and more. Very important, regardless of the type of app that you are using. And I'm just mentioning three, but there are several ways and you can just gamify your learning processes. And remember to study in patterns, not using isolated words. And the most effective strategy for you to be successful in your test, it's gonna be practicing under time pressure. Okay, so you can do that with ChatGPT or any other bot of that sort. You can do that with Kahoot. So just produce the language, produce fast. Okay, and that's it. Thank you very much. Again, my name is Laura Mendoza.
Thank you so much, Dr. Mendoza, for a wonderful presentation. So I will stop the recording now.